Hello, everyone. After a long COVID hiatus, we are back with Talking Point. I'm Mayor Mike, and with me is Lisa Faldudo from the United Way and Bob Smith from Aspirus. May is Mental Health Awareness Month, and that's what we're going to be talking about a little bit today. And as we all know, it's been exacerbated by a year-long pandemic. Welcome to the show.
Thank you.
Thanks for having us.
So, Lisa, tell me a little bit about your experiences with dealing with mental health issues with the public and how that's been transformed because of COVID.
Well, let me just talk a little bit about the initiative that United Way of Portage County started as a result of the 2017 Life Report. Mm-hmm. So based on data from that Life Report, we had 4 calls to action, and one of those calls was on mental health. So what we did is took on mental health as our second initiative in addition to our Born Learning initiative. And so we formed an executive team, which Bob is a member of, and we went through tons and tons of data. Remember that data walk, Bob? Went through tons of data to determine what direction we would take. And what we came out with was there were 3 main issues for folks in Portage County, and that's access, children, and root cause issues. So that was our starting point, and as a result, we formed a whole triage underneath a website, which we call peaceofmindportagecounty.org.
Okay, well, great. So, I know from being in this position and the feedback that I get from not only community leaders, law enforcement, emergency services, that mental health issues are really, let's call it a foundation for a lot of other social problems that people experience. How did the United Way get involved specifically with the peaceofmindportagecounty.org?
Well, a few years ago, we attended a conference by the Medical College of Wisconsin, Advancing a Healthier Wisconsin. And through that conference, we saw another community who was implementing this type of a website, and we became very interested in having that for Portage County because it's important that you house all your mental health resources in one spot. Okay. So this website was developed as a result of that idea, along with the fact we took the mental health initiative.
Good. And Bob, your involvement, not only being on the leadership team of this, but working through Aspirus, I imagine that you have initiatives there because Aspirus has to deal with that. Give us your background a little bit.
Yeah, mental health, again, like you said, is a foundation for many things for people and a foundation for their physical health. And without good mental stability, people have a hard time doing the physical things, focusing in on diet and exercise and things like that. This, even prior to the pandemic, was an enormous issue for us. The type of patients that we were managing in our emergency rooms, and they come back over and over again, or how we struggle with the management of these health issues on a floor when a person is, dealing with some mental crisis. So, yeah, it touches us on a daily basis and our staff on a daily basis.
And I don't think there's anyone that isn't adversely affected from poor mental health. I mean, it goes from children through teens. Teens are especially important. Adults in our everyday lives, we get wrapped up in things and we lose track of our own well-being. And then, of course, as we progress through life, so it's something that affects every single one of us.
It does, and it's what we saw as an executive group when we were looking at this is the stigma behind it and the silence of it. I mean, we're sitting here talking about it today. Certainly, I think the pandemic has brought it forward more in the limelight. But this is the main issue. We've got to get people talking about it, recognizing, acknowledging it. It's not a bad thing. Like you said, most people are dealing with this. Okay. Let's find an effective way to deal with it. And our website has many tools out there for people to do that.
So, Lisa, I know you brought some statistics with you.
I did.
We're always numbers here with the city, right?
We're always numbered.
Why don't you go through some of these? Because when we were going through before we started the show, some of them are quite alarming.
They are alarming. So I pulled these from NAMI, which is the National Alliance on Mental Illness. 1 in 5 U.S. adults experience mental illness each year. 1 in 20 U.S. adults experience serious mental illness each year. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year. 50%, and this one is really significant, 50% of all lifetime mental illness begins by the age of 14, and 75% by the age of 24, which is again why you need to be proactive and get to kids when they're young. And suicide is the second leading cause of death among people aged 10 to 34.
Wow, that's absolutely terrible. So I imagine, it seems logical that as you're developing, education is also important, but your mental health is important at a very young age, younger than you would think. And those things, as you can see from the statistics, create lasting issues on into adulthood. If parents see something, or maybe peers, or a coach, or some other adult figure sees something that might be an indicator of a mental health issue with someone who's younger, what should they do?
Well, if it's a coach or a teacher, certainly involving the parents in the conversation, because it's important to look at the whole child, as well as their home life, as well as whatever their school, or if they're involved in sports or what that may be. But certainly, if you go to the peaceofmindportagecounty.org website, you can find information. There's library articles. There's actually youth and adult assessments that you can take on the website. And the really neat part about our website, which is unique to Portage County, is it will give you information to connect to the mental health navigator. So we have 2 mental health navigators in the process of getting a third from CAP Services, and they their phone number's on their email address. And they will help you, like search, get you connected to services and supports that is the best fit for you.
Okay, and that anonymous screening, I think, is important, because this is something you could take for yourself, something that your friend could take for you, I suppose. Does somebody notice a change in Mike's behavior, that sort of thing, and maybe we can get the help we need. Often we try to put on a front, and I think a lot of people do that. Where it's stress of the job, stress of, masks and school and friends. And I remember when I was a teenager, everything was the most important thing in your life. And it just doesn't, that's not really the case. But a lot of times we find ourselves saying, no, I'm good, I'm fine, don't worry about it, I'll get over it. Or we find a vent to kind of release some of that stress. And that, I think, leads to potentially some drug and alcohol related issues. What are some of the indicators that, even for myself, where, boy, I notice I eat a lot, right? And I think that's one of the ways that I deal with stress. I don't want to do that. But what are some of the indicators? I would have never guessed that had I not been talking with somebody. So what are some of the indicators people can look for that you may need to sit down and talk to somebody, or take that self-evaluation?
I think change in behavior, if you're a teen or a younger child in school, a change in your academic status. Certainly grades were good and now they're falling.
Okay.
Things like if you're in your teen's bedroom and you see a vape, or you see some type of drug paraphernalia,
Sure.
would certainly be another sign that they're self-medicating and trying to mask something that's going on in their life. Do you have anything you want to add to that, Bob?
Isolation. People are pulling back, isolating. They're challenging themselves, and so there's a lot of inward looking and thinking with these individuals.
Okay.
So watch for those types of behaviors as well.
Okay. And I think one of the things that we want to stress too is that there is help out there. This is not an unusual thing. I mean, especially with the pandemic, this is something we're really all dealing with to some level. Everybody is being touched by this, and we need to make sure that we're keeping ourselves healthy. So we need to take time for that. So it's okay to talk about it. And if if you're unsure, maybe I'm a little overstressed, you can contact take the self-evaluation, contact peaceofmindportagecounty.org, and they can put you in touch with resources that will help you overcome the issues, right?
Correct.
So let's talk a little bit about the rise, because that's a big deal, especially because of the pandemic. The rise in mental health issues. I mean, people are sitting at home. I had talked to a woman early on. She hadn't left her house in 3 months. That has an effect on people. But the opposite is true too. If, we're a divisive country right now, so you're getting it from both sides. Maybe your beliefs don't align with your friends' beliefs or family members' beliefs or parents and children disagreeing. What are some of the things that you've been seeing? And Bob, maybe if you want to take this one, what are some of the things that you've been seeing escalate, like rise in numbers? I know, domestic violence is up and drug abuse.
and the way people cope with the stress and the fear. Fear is, what's driving, the anxieties I think behind most people right now with the pandemic.
Yeah.
Fear, uncertainty, waiting for answers and questions, information coming out that is confusing. You hear one thing 1 minute, it's different 2 days later. So you see a lot of people coming in, with high anxiety, how to deal with this, how do I manage my fear? We've seen some self-harm issues arise in our EDs, and that's unfortunate. And this is a great resource. And just what I stated before and what you stated, talk about it.
Talk about it.
You got to find an outlet, whether that's a loved one, a family member, find an outlet. And if you can't find one, then we've got some outlets here for you. It's a great tool. It really is.
And it's okay not to be okay.
Yeah, correct.
That's true. That's one thing I learned, especially in this job. So I notice you have some more information.
I do.
You want to share some more of those statistics for
Sure.
us?
So the executive team went over some more recent data since the beginning of the initiative and really stumbled onto the fact that the teen population is having significant struggles. So it's not only that developing brain at that particular time of life, but it's also the fact that they're missing things like prom and homecoming and spirit week and so many things that you spend your whole school career looking for, and that's just gone. It's just gone. So they're really struggling. So I want to share, there's an organization that did a pediatric private healthcare claims study. So this does not include Badger Care. This would just be private health insurance. So what they did is compare 2019 pre-pandemic to during the pandemic, ages 13 through 18. A 334% spike in self-harms for that age group. That's huge.
334%. Wow.
First phase of the pandemic, which is March, April 2020, claims for any mental health disorder increased 100%. Anxiety, depression, and adjustment disorders exploded in spring of 2020, which is an increase of 80 to 90% compared to 2019.
Wow.
So, we've formed a planning and implementation team as part of the initiative, and what we're looking at right now is what can we do in Portage County to support our teen youth. So one of the things the Stevens Point School District did as a result of receiving funding from the COVID Relief Fund with United Way and the Community Foundation is to start a coffee shop after school 2 days a week. So teens have somewhere to gather together. They're offering things like yoga, mindfulness, and just a variety of other community resources to support those teens. And so we're looking for more short-term like that, more short-term things that we can offer to teens in Portage County, and then we're also looking long-term. So what can we throw into place quickly, and what can we establish that will go for years?
Well, it's unfortunate that we have to be reactive, but those numbers are so alarming that, something's got to give, right? And I'm glad that there are locations people can go to get help, to evaluate yourself rather than trying to run this thing alone. Like you said, it's okay to be not okay. And more people are dealing with it than we think, so you're not alone out there. So Peace of Mind, portagecounty.org, and we're going to get the website up on the video. If you're listening to the radio, hopefully you're listening in color, and you can see the website. No, you can't see the website. It's Peace of Mind, portagecounty.org. I know it's a long couple of words, but they're all strung together. Peace of Mind, portagecounty.org. They can also get information through the United Way's 211 system that can connect them there, right?
Mm-hmm. And you will find United Way's 211, a connection right on this website as well. So if you're there, you can get back to 211 really easily.
Okay, great. And I know, this doesn't come cheap or free, and you've got some sponsors that have helped organize this, including Ascension St. Michael's, the United Way, Aspirus, the Portage County Health and Human Services Department, and the Marshfield Clinic. So with all of the primary medical providers in the area banding together, they must realize too how big an issue this is, and know that they need the resources to help.
Yeah, definitely. And in the collaboration amongst all of us and the data and the information we brought together, it was the same story at every one of these institutions, every one of these organizations. It's a struggle we're all having, and we all recognize the need to stop this cycle, and getting to these teens, these kids, and giving them some resources, we hope is going to then prevent some of these, escalation of mental issues later in life for these kids.
Right. And that's really what it comes down to. If we can address those foundational issues early, you prevent so much going forward, and really make a bigger impact the earlier that people can get the help that they need.
And we give them skills and things that they can do, and then they're going to teach their kids, and that's how this grows and spreads.
Okay. Lisa, is there anything that we wanted to talk about that I haven't touched on yet?
Well, the only other piece is it's Mental Health Awareness Month, and there are several things going on in the community from the Mental Health and Suicide Coalition of Portage County. So there are some community conversations, and you can go to their Facebook page. And there are only 2 of those conversations left. On May 18th is suicide prevention, which is question, persuade, refer training. May 25th, building resilience with Dr. Pam Beyer. She's a clinical psychologist at Ascension. So those are available. Anyone can register. You will also find those events on the community calendar on peaceofmindportagecounty.org if you want to get a live link. There was a poster contest, which you will find, again, those winners and even others on the Facebook page. They've done a bingo game. There's displays in the library windows of those posters and other things. There will be rocks painted around the community. NAMI and Rock Point are both doing those. Mental health tip sheets were sent to all schools, so parents have access to those resources. And then if you go to Zest during the month of May and purchase lemonade, 20% of the proceeds go to Suicide Prevention and Mental Health Awareness Coalition of Portage County.
And Zest, that's right on Isidore Street.
Right on Isidore.
So I'm going to swing by there after we're done here and pick up a lemonade.
That sounds great.
So there's a lot of things that are going on, and I know we're already most of the way through May, but they can get that information at peaceofmindportagecounty.org. And you said you have a calendar there, so the events that are still going on, they can get involved in, and they can make a difference. Bob, anything that you wanted to touch on?
No, I think the website, again, is a fabulous tool. So outside of directing people to that website, finding an outlet for these issues, I think that would be fabulous for people.
Good. And, it doesn't end in May.
Oh,
right?
no.
We're trying to raise awareness during the month of May. But, if there are things that people want to do in June, July, August, the whole year, we need to be aware of this personally. But I think that the resources that you provided are going to be helpful. So don't think that it ends in May. It's going to be ongoing. And if you feel you need those resources, they're available. And I think the biggest thing that we can leave people with is you're not alone in this, right? There is help out there. And even if it's just a small amount of help or a large amount of help, people are there for you. You don't have to take care of this by yourself. You're not alone.
Mm-hmm.
Very correct.
Exactly. And, people a lot of time think about therapists, but NAMI has some great support groups, NAMI Wood in Portage County, and those are also listed in the community calendar. So, if you don't want to go to a therapist, you want to try support group, there's support groups. There's tons of support groups in the community available to you.
Yeah, and the peer support groups are probably a great starting point. I know that veterans, they have a very unique form of mental health issues, and usually it's only other veterans that can understand that. So they have peer support groups where they get together and they talk things through. You're not alone. Teenagers, of course, every teenager is dealing with the same problems. The peer support groups are really a good sounding board because everybody else, again, is dealing with the same sort of problem.
Yep.
We have a mayor sounding board where we get together and talk about our mayor problems all the time. And it's unique because not many other people understand the budget restrictions and things like that the mayors have going on. So it's nice to talk to peers. I imagine it's exactly the same when it comes to just about every other walk of life.
Mm-hmm. Absolutely.
If someone wants to get involved, are there opportunities for people to volunteer, maybe mentor, or even handle a hotline for a while?
Well, there's a lot of programs across Portage County, and I often think of like Big Brothers, Big Sisters. And that certainly is a mentorship program for youth. Boys and Girls Club is another great resource. I'm not sure right now if school districts are utilizing volunteers. I don't think so, but probably next year, I'm guessing they will be back on track with that. So there's a lot of different youth groups and organizations you can volunteer. You can also go to, United Way has a volunteer website called volunteersrock.org. You can also call our office or call 211 to find out volunteer or mentorship opportunities.
Okay, great. Well, I think that wraps up everything we wanted to talk about for Mental Health Awareness Month. Again, that website, peaceofmindportagecounty.org. Lisa, Bob, I want to thank you for coming on the show and giving us some information that we can think about for a little bit.
Yeah.
Great.
So, and before we leave, I think it's important to say that we are filming this after the CDC guidelines have changed. We've all been vaccinated, so it's completely okay to be in the same room together. Just want to get that out there. Yeah, because people don't know necessarily when I was posting pictures of stuff that was 2 years ago and they were, where's your mask? So if we weren't vaccinated, of course, we'd be wearing a mask. Thank you very much for joining us again, and we'll see you next time. Until then, I'm Mayor Mike, and we were Talking Point.